in this little valley. So it's sort of on the floor of the canal and on the anterior side. And anterior means towards the front of the body, so towards the nose, and posterior means towards the back of the body. So in this case, anterior would be the left-hand side and posterior would be the right-hand side. So the recess is on the floor of the ear canal and up the left-hand side. So just before the canal meets the eardrum, it sort of goes in and then out again, in a U shape, basically. So we've cleared most of the debris. We've just got a little bit more, and this particular piece here is on the eardrum. So not this piece, but the piece after, actually. You can see it's all coming out quite easily thanks to the olive oil. So if we go back in with the fine end, and a fine end is just very similar to a regular suction probe, but it's much smaller in diameter. So and by virtue of that, it just makes the suction slightly less powerful, but that's a good thing if we're that deep in the ear canal, because the sound of the suction can be quite loud, and we certainly don't want to be going in there with a large suction probe. So it gives us a little bit more control as well. So this last piece here is on the eardrum, but again, this will come away fairly easy thanks to the olive oil. And this patient has had suction many times by myself and by a local ENT surgeon, so he knows the routine fairly well and he's used to the noise level. So a fairly clear eardrum there, and we've now just got this debris on the posterior wall, and this was a little bit tricky. The patient was finding this just a tad uncomfortable, so we weren't able to get all of it. But all things considered, it's a fairly good outcome. We've removed most of this debris, and importantly, we've freed up the eardrum from all that dark wax so that the patient can hear normally again. And we've got a nice smearing on the canal walls to protect the patient from infection and stopping the ear from drying out.